Hello, and welcome to the StellaLife Innovators series. I'm Liz Lundry, and today I'll be talking with Dr. Hana Hobbs. She is a diplomat of the American Board of Periodontology and has over 25 years of dental and periodontal experience. She's an outstanding clinician, author, international speaker, and educator, presenting topics such as aesthetic periodontal treatment, aesthetic implant placement, treatment of periimplantitis, the link between periodontal diseases and diabetes, and more. In fact, she received the Most Innovative Clinical Research Award from the Western Society of Periodontology based on her thesis of the link between growth factors and healing in periodontal therapy in diabetics. She's a true innovator and is joining me today to talk about lasers. Welcome, Dr. Hobbs.
Thank you so much. I'm so honored to be here.
And I am honored to be speaking with you. I love lasers. I've been a laser trainer for many years, over 15 years, and have used them in my practice as a clinical hygienist. So I've seen so many great advantages myself. So I'm excited to hear from you about why you decided to add laser periodontal therapy to your practice.
So that's a great question. About 10 or 11 years ago, I had a practice and I was very successful, but there were some cases that were just not responding despite everything I did and the patient. And the surgeries are not easy on the patient or on you as the clinician. And so I had been at a periodontal meeting and saw somebody talking about a laser. And so I went to my mentor and I said, hey, I saw the laser. What do you think? And the academy hasn't really given any opinion. He goes, you can't really wait on the academy, but I'll just tell you that in my experience, it's been a game changer. So I got the laser and I got my training. And I think that's really important when you get a laser that you get appropriately trained and you have a company that's going to stand behind you. That's very, very important. You can't just wing this. You can't buy this from like a dental supply company and not get trained. And so I got trained and then I started treating cases that I thought were hopeless. The teeth needed to come out. And one by one, I had just incredible results where I was able to maintain teeth and save them. And the patients have virtually no problems, no pain. They stay on a scale of 1 to 10, 10 being horrible. They don't have the recession. They don't have the sensitivity. And so I was able to keep more and more teeth. So I started doing more and more cases. And then as I became more experienced, my cases came back to me and I would see where there was an area that didn't heal correctly or didn't respond as I wanted. And I would adjust in my next treatment. I will say that in laser periodontal therapy, occlusion is super important. And many of us just completely overlook that. And I've learned from seeing my cases come back to me that if the occlusion isn't addressed correctly or the interference, you will get a recurrence of the pocket. So I've had many cases where I just was completely blown away by the results I got. So then I started getting more, well, I'm going to try this. And then about 3 years ago, I bought a different laser, a photonal laser, because about a third of what I do is treat failing or ailing implants. And I just did not think in my armamentarium I had enough to predictably treat the failing or ailing implants. But this has been a game changer for me. I literally, I'm amazed at some of the results that I see with treating periimplantitis because it's not a slam dunk. But that laser has allowed me to decontaminate the implant without disturbing the surface from the manufacturer. And then, of course, I graft and do PRF, but it has been remarkable.
Yeah, it really is amazing. It does decontaminate as the best that you can achieve as far as decontamination of a pocket. And this is the benefits that I've seen with it. And again, the patients are very comfortable and it's not as invasive as, the techniques that we used to use. Do you have any other kind of specific comparisons that you've had more success in laser as compared to traditional periodontal therapy? I know you mentioned the periimplantitis cases. So I don't know if you wanted to share some other benefits that you've seen.
Well, I had a case like a year ago. The patient had osteonecrosis. He had multiple myeloma, was an IV bisphosphonate, was referred from the oncologist to primary care to the dentist, the oral surgeon, to me. And, he was in very frail health. Obviously, he had multiple myeloma. So I decided to treat the osteonecrotic site with a laser because usually those people, you just basically want to put him on something. You don't want to aggressively treat him because their wound healing is so compromised. So I treated him with a laser, and within 2 weeks, the areas that had pus and frank necrotic bone resolved. And I got so excited when I saw him, and he was so happy. He was ready to move on to the upper arch to treat. And he was a gentleman in his 90s. He had multiple myeloma for 7 years. So the risk of osteonecrosis goes up the longer you're on the IV bisphosphonate. And for me, this was, I was able to really make an impact on his life. And he wound up dying like 2 years later from the multiple myeloma. But meanwhile, his chief complaint to me when he came in, he's like, honey, I just want to be able to eat. And I was able to give him that. And cure his infection without IV antibiotics and suspending his IV bisphosphonate. It just struck me how just an incredible impact you can make on someone's life like that.
I'm getting goosebumps hearing about that because when you really, it is a life changer. So even though maybe he lived for another 2 years, he was able to enjoy his food. That's
Yeah,
one of the most basic needs and things that we enjoy most as being humans. So, you really gave him a gift and then learned in the process too.
I
So
did.
that's
And then
awesome.
I tried the more I saw, the more I tried. I'll see somebody with hyperkeratosis. You'd have to deglove the whole site and lose the attached gingiva. Whereas you can treat it with a laser and not have that. I can use biostem with a laser after, a surgery to reduce the pain from the injection site or just reduce the overall pain. So I've just expanded my applications, for lack of a better word, more and more.
Yes, yeah. That's just phenomenal. So really innovative approaches too, and that grows as you have different cases and you can try it with different applications because it is so versatile and
Yes.
it not only decontaminates, treats the site, it also stimulates the mitochondria. Just so many benefits. You can get hemostasis, just wonderful things you can do with a laser. So what advice would you give somebody who is thinking about getting started with a laser? I know you talked about training, and as a trainer myself, I can say absolutely, you want to make sure you get some really good hands-on training, and more than just on the pig jaw, or a
Yeah.
tomato, but like a really good course. So yes, please share your advice of how to get into using lasers.
So the first thing when you want to do lasers, you need to ask yourself 3 questions. One, what type of tissue do I want to treat? Soft tissue, hard tissue, or both, or implants, because then you can choose the type of a laser you want to use. Second, will there be training? Will the company be there if I have a concern about a procedure? Will they be there to back me up? Will they be there? I can go for training. How much hands-on training do I get? Is it virtual? Is it on a pig's jaw? Or do I go and learn? And are there mentors to help me along? And 3, what will be my return on my investment? Which is, obviously a laser is super expensive. So a lot of people, it's not a gimmick. It's not just some gimmick. You need to be able to use it. And honestly, the more I use it, the more applications that I see and the more I've expanded my treatment. So the biggest thing I think is training. I've given a lot of lectures and people will email me, I'm going to buy such and such a laser for $500 and I'm going to watch a YouTube video. Well, that's not right. You need hands-on training. You need someone to talk to you about what you've done right, what you've done wrong, what the mistakes they've seen. It's so important. Just like anything in the wrong hands, it can be destructive. But like I feel another thing too is be patient with yourself. Look at your follow-ups, learn from what you have done, look at the tissue you're interacting with, see what has resulted. When you see the patients for follow-up, see your follow-ups, bring them back, look at what you've done. Has it been the result that you expected? If you have, it isn't, tweak your procedure, call your mentor, call the trainer. Hey, I've seen this. I'm not seeing this. I photograph all my cases from start to finish. And so I can look back, even after all these years, I look back and say, you know what? I, I really did X, Y, and Z wrong, or I should have given more energy or should have given less energy. And you just learn from that.
Yeah, what I love about lasers from the many years I've been using them, again, the patient comfort, you can see
Yes.
some really rapid results, reduction
Yes.
in inflammation right in front of your eyes sometimes, which is really cool to see. But then there is that learning curve in that you need to make adjustments because of different tissue types, different
Yes.
levels of inflammation. And even obviously within the same patient's mouth, you're going to be making adjustments from one area
Yes.
to another. So yeah, the importance, I mean, YouTube videos are great as to take a look at them, but to be able to have someone really mentor you is really the best way. So I'm so happy that we talked about this because I know there's uh, been a great interest out there. I know some people have been skeptical through the years because
Yeah.
there are research articles that say, yeah, this is great, the laser is wonderful, and others that don't have that opinion. But I think what's most important is to do what you've done, is
Yeah.
to dive in there and find out for yourself, how you can really change people's lives.
Yes.
So
Exactly.
exciting stuff. Yeah, so we're looking forward to hearing you at your lectures. So everybody, please keep an eye out for Dr. Hana Hobbs. And I look forward to seeing you myself sometime and learning from you. And again, thank you so much for your time
Thank you, Ms.
today.
Lundy. It's so appreciated. I'm honored to be here, and I'm a huge fan of StellaLife. Have been for 3 or 4 years. Every lecture I give, I have like a slide of StellaLife, and it is for a lot of patients. They're so used to being on chlorhexidine and the heavy staining, and they're like, "Wow, what is this stuff? It's so soothing." And you just tell them about it. And in all my lectures, I always recommend, in all my surgeries, I tell the patients, we're going to go with StellaLife. It is so soothing. It's antiviral, antibacterial. It'll help the area heal so immensely. And most of my patients wind up afterwards going on and buying the oral kit themselves from either the company or Amazon because they really, really love it.
Yeah,
Yeah, they give it to like their elderly parents because it helps make the mouth feel better without all the alcohol and all the other ingredients that come in the other mouthwashes.
yeah, when doctors are dispensing it, they're finding that their patients, and I've spoken to actually many periodontists who are having them use the rinse on an ongoing basis for regular daily hygiene. And they're finding that the patients come back without the bleeding inflammation
Yes.
when they come in for their maintenance. I'm sure you've seen that. And then in conjunction with the laser, as I teach hygienists how to use lasers, I do recommend that they use some type of an ointment or a gel. And my favorite one, of course, is the StellaLife gel that you can apply at the end of the procedure to, help the patient be more comfortable and refresh them as well. But helps to
So
reduce more inflammation and give them more pain management. So, and you've discovered that. So it's a
yeah, I
great
use my
combination.
gel in a little, also in another way, before I place my implant. After I place my implant, before I put my cover screw or healing abutment, I dab it in a tiny amount of StellaLife, because if there's any contamination that's gotten inside the body of the implant, the StellaLife is there to help prevent any further problems. And I've just seen significant decrease in potential problems, or the abutment coming off, or granulation tissue. I've just seen a better result, and I've been doing that for several years now. I just put a dab of StellaLife on the healing abutment screw.
That's a great tip. Really appreciate you sharing that, doctor.
Sure.
For all of you out there, you can definitely get going with your lasers and be creative and help so many people, and be creative with your use of StellaLife as well.
Yes.
So I want to thank everybody for joining us today. Please take care of yourself, stay safe and happy, and look forward to seeing you next time.
Thank you so much.
Thank you.